Staphylococcus. Introduction. Staphylococcus are gram-positive cocci arranged in grape-like cluster. They are commonest cause of suppurations. The medically important species of genus Staphylococcus includes Staphylococcus aureus, Staphylococcus epidermidis, Staphylococcus saprophyticus. Staphylococcus aureus. Morphologically, they are gram-positive cocci arranged in grapes-like cluster, non-motile, non-sporing, approximately 1 micrometer in diameter. The culture, they grows rapidly on ordinary culture medium. The optimum temperature for the growth is 37 degrees centigrade. They are aerobes and facultative anaerobes nutrient agar. After overnight or 24 hours incubation, the colonies are 2 to 4 millimeter in diameter, circular, smooth, convex, opaque, and easily emulsifiable. Most of the strains produces a golden yellow pigment. The pigment is believed to be a carotenoid. Blood agar. The colonies are similar to those on nutrient agar, and in addition, a beta type of hemolysis is seen. Mechanic agar. The colonies are very small and pink due to the lactose fermentation. Mannitol salt agar. This is both a selective and a indicator medium. It contains nutrient agar with 1% of mannitol, 7.5% sodium citrate, and a phenol red as an indicator. Blood agar. This medium is prepared by mixing sterile nutrient agar and sterilized milk. The pigment production is enhanced on this liquid medium. The uniform turbidity is produced in the peptone, water, on or nutrient broth by chemical reactions. The catalyst positive, oxidase negative, break down carbohydrate by fermentation. The pathogenic strain of Staphylococcus aureus can be differentiated from other non-pathogenic strain. Example, Staphylococcus epidermidis by the following characteristics: beta type of hemolysis on blood agar, production of golden yellow pigment, coagulase production, mannitol fermentation, gelatin liquefaction, phosphatase production, productions of enzyme deoxyribonuclease, telluride reductions. Antigenic structure of Staphylococcus aureus is shown in the figure. Toxins and enzymes. Toxins, hemolysins, alpha, beta, gamma, and delta hemolysins are produced. Leukocidin, enterotoxin, toxic shock syndrome toxin, exfoliative toxin. Enzymes, coagulase 8, AH, antigenic type, phosphatase, deoxyribonuclease. Disease, cutaneous infections, pustules, boils, carbuncles, abscesses, stylus, impetigo, emphagus, neonatal, wound and burn infections, deep infections, osteomyelitis, tonsillitis, pharyngitis, sinusitis, pneumonitis, emphysema, endocarditis, meningitis, bacteremia, septicemia, pyemia, urinary tract infections, food poisoning, nosocomial infection, skin exfoliative disease, bullous impetigo, pemphigus neonatorum, Rettus disease, scaled skin syndrome, toxic shock syndrome, antibiotic sensitivity. The penicillin resistance in Staphylococci is due to the following: productions of beta-lactamase penicillinase, which is plasmid coded and transmitted by the transductions or conjugations. Beta-lactamase inactivates penicillin by splitting the beta-lactam ring. Reduction in affinity of penicillin binding protein of staphylococcal cell wall for beta-lactam antibiotics. This type of resistance also occurs in beta-lactamase resistant penicillin such as methicillin, nafcillin, and oxacillin. These strains are called methicillin resistant Staphylococcus aureus. The methicillin resistant correlates with the presence of resistance gene MECA that codes the unique penicillin binding protein PBP2A, not affected by the beta-lactamase resistant penicillin. This gene is transmitted chromosomally. Although the predominantly a hospital pathogen, methicillin-resistant Staphylococcus aureus is becoming more common in community. The hospital personnel harboring methicillin-resistant Staphylococcus aureus has been implicated as the chief source of nosocomial infection, eradication of colonized site. Example, nose or skin with a topical agent is often indicated for reducing the risk of cross infection in hospital. The bacterium may also develop a tolerance to penicillin, by which it is only inhibited and not killed. Laboratory diagnosis. These are collected according to the nature and lesions: pus, suppurative lesions, sputum, respiratory infections, blood septicemia, urinary tract infection. C as a meningitis, feces, food poisoning, food or vomit, food poisoning. Nasal and perineal swabs are collected for the detection of carriers. To collection and transport, the specimen should be collected in a sterile container under all aseptic conditions. The sterile swab should be used for collection of specimen from the site, such as nose or perineum. The specimen should be transported immediately to the laboratory and processed. Direct microscope. The direct microscope with the gram stain smear of pus or wound exudate is useful where gram-positive cocci in cluster may be seen. This is of no value for specimens where mixed bacterial flora is normally present. Example, sputum culture. The specimen or inoculated on the following media: blood, agar, and peptone water. The specimen such as the feces and swabs from the carrier or inoculated on selective medium such as salt, agar, Robertson cooked meat media containing 10% NaCl. The inoculated medium or incubated at 37 degrees centigrade for 18 to 24 hours. Colony morphology and gram staining. On bread agar, the colonies are 2 to 4 millimeter in diameter, circular, raised, opaque, and produces a golden yellow pigment. Beta hemolysis is seen around these colonies. The pigment is not diffusible into the medium. On gram staining, they are gram-positive cocci, 1 micrometer in diameter, arranged in grapes-like cluster. The uniform turbidity is produced in the peptone water. Non-motile cocci in cluster are seen in hanging drop preparation. Biochemical reactions: catalase plus gelatin liquefaction, coagulase plus tellurate reduction, mannitol fermentation, acid production without gases, production of enzyme phosphatase and deoxyribonuclease. Both are positive. Coagulase negative staphylococci. The coagulase negative staphylococci forms the part of normal flora of skin. They are opportunistic pathogens which causes infections in delibated or immunocompromised patients. The differentiating features of Staphylococcus aureus and coagulase negative staphylococci are shown in the table. Micrococci. Micrococci are free living in environment. They are saprophytes and commensals. They may rarely cause opportunistic infections. They are coagulase negative. The distinguishing feature of Staphylococcus aureus and micrococci are shown in the table.